Good afternoon, my name's Julian and I'm the remote areas first aid trainer and consultant for Aardvark, and I'm from Medic Services International, and we're based in Malvern in Worcestershire. We're going to look at the emergency care bandage. Okay, so all this stuff that's been developed has been tried and obviously tested out in conflict zones and hostile environments, so you know the product works. So the emergency care bandage, here we go, first one. So the emergency care bandage comes in a packaging like this, and this holds about a litre and a half of blood. Okay, tough and robust. Okay, now to get it open, there's a little black V you can see there. So what you do is you tear into that and tear into that. Now it then comes out into another packaging, and it's like that. Okay, so the red thing's there, and then all you do is you tear that open. Now, a good thing about these bandages is, first of all, you got a sign that says other side to wound. Okay, so the white stuff, as I like to say, goes on to the red stuff. Comes in a few sizes. You've got your 6-inch, you've got your 4-inch bandage, and there's also now one called a T3, which I'll talk about in a bit. Applying the bandage, okay. So here's one I made earlier. So I've got a leg wound. First of all, I have a look inside and make sure there's nothing sticking out. Next thing I do, I put the bandage on. I take it around there, seal it off there, around there, seal it off there. I take it around, I'll take it around. Now a good obviously tip is, what you can do if it's not got a clip, because you see that one there, that one's got a clip in there, you put a twist in it and acts as a bit of tension. Okay, so taking that around, you've got a clip thing there, you can't probably see, it's underneath there, the clip thing. All you do is you clip that in there, and you clip that in there like so, and that's your bandage applied. What we got here is the 4-inch bandage. So one of the things they developed on this bandage was the white bit there. If you can see there, it's got a hole in it, and the new thing is that there. Now that, as you saw earlier on, I put the tension in, I screwed it down. So if you've got an injury up here, what you can do is a top tip. You take the bandage, you slide it through there. Okay, so when you slide it over your arm, you put it over the wound, a bit of tension there. I'm taking it around, see how easy it goes on, taking it around there, take it through there. Now when you're bandaging, always take your time. People got this habit of rushing. The thing about this, all this equipment we're going to demonstrate here at Aardvark today, is the fact that basically all this equipment is a self-aid stuff. Okay, so you can either have it being done by obviously 2 people, or it can be done by yourself as well, because you might not have that second person to actually do it for you. Okay, so we're taking it round. Once again, you've got the clip, put the clip in there, and then what we do, we take that bit there and we put that clip in there. So you can see now the bandage is rather secure. Once again, make sure no blood's coming out there, bacteria going in. Normally a good little obviously test is, if you can get just about 2 fingers in there, that means it's not on too tight, because we don't really want to actually take off the circulation. Okay, now they've also brought out this T3 bandage. Now I rather like the actual T3, I discovered it a year ago. So the T3 bandage, what that is, we used to carry the ECB bandage also with as well. We used to have a piece of gauze, but the people who developed the ECB thought if you've got the bandage, so there's your 6-inch, then you got a piece of gauze, so why not somehow put the actual gauze in? So you got here, we've got some gauze. Okay, we've got some gauze. So now let's have a look at a thing now called wound packing. So here we've got our arm. So you've got your casualty's arm, either yours. When we wound pack, we're feeding it in. Okay, now catastrophic bleed is basically an artery is being cut, and bright red blood is spurting out all over the place. Okay, you spurt out about obviously 6 foot. Some arteries, like the femoral artery in your leg, is about the same thickness as your finger there. Okay, and it spurts out about 6 foot. and it doesn't just like drop down. The arteries have got this habit, you cut them like an elastic band and they spring in. So what you're doing is, there's your casualty and we're feeding it in. Don't forget to wear gloves when you actually do this, okay? Feeding it in, you're feeding it in. You know what this is actually acting as? It's actually a sponge. So this is soaking up the actual blood. Now, top obviously tip is, some people say cut off that bit once it's got in. My advice is you use that gauze there to take it around. So what you're actually doing is you're actually extra bandaging. So you're taking it round, okay? Making it round, taking it round. And then what you do is you plug that in there. Take your bandage. This one's got 2 pads on it, it folds out, so that's like a litre. That's increased to 2 to 3 litres. Put the pad on and take it around, okay? Don't forget we're sealing off that end, taking it around. Remember, we've got that clip there, we take it through the clip and then we take it back again. And taking it around, okay, taking it around, seal off. Let's see, just keep wrapping it around. We use all the bandage, we won't cut the bandage off. And then what we do is we got the clip and we put that clip in there like so, and got that other clip, get that one, just get that one in there like so, and that's that clipped in. Make sure it's clipped in, because what we don't want is it springing off. Drop us an mail if you've got any questions about any of our products or the training which can be provided in the UK and overseas. Thank you very much.